Dr. Chris Wilson here with Think PT at our offices in Centerville inside Club 51. Today we're going to talk about thoracic mobility and do a little drill that you can do pretty easily to help improve your thoracic mobility and particularly thoracic. Hi, this is Dr. Chris Wilson, physical therapist with Think PT, here today to talk about the thoracic spine, your upper back. We're going to do a little drill on it to help improve what's called extension or bending backwards. And all it's going to take is 2 tennis balls and some tape. Again, before doing these kinds of things, you should be checking yourself out with a medical professional, a physical therapist, a doctor, somebody along those lines, just to make sure that if you are having pain, that it's not something else before going on and doing some of these mobility drills. I hope to see you here. What to do with this particular exercise is you take the ball. You're going to think about the line in between the 2 balls as where your middle of your spine will go, your spinous processes. And you're just going to line it up, probably about midway up your back to start out with. And once you're on there, you'll feel a ball on each side on your paraspinals, or the muscles outside of your spinous process. Once you get there, you just want to relax over the ball a little bit. And just breathe normally. You're going to feel some pretty good pressure. You may even have to adjust just a little bit to kind of find it so it's nice and symmetrical side to side. And you'll feel that pressure up through your back. What I like to do from this position is just a couple of crunches, and that's really going to increase the pressure through your back. So just up, about 5 times, just like that. And then I'll take my hands overhead to get a little bit more. Now we're adding some functional movements, some contralateral patterns on top of it. Just a couple times, and then I'll roll up just a little bit, maybe an inch or 2. Again, same thing, just coming up nice and good. Now the tennis balls can be a lot of pressure. You want to be mindful of that. If you don't tolerate deep pressure, try to do it on top of a nice foam pad that's going to make them a little less intense into your back muscles, or use old worn out tennis balls that won't have quite as much pressure. Again, we're going to go up overhead, just back and forth a few times. Again, one more time. I'll usually do it 3 or 4 spots. Up. If you hear some clicking, popping, that's all right, as long as it's not painful and as long as you've been checked out by that medical provider first. They've shown you proper form and are able to assess and reassess you. Just back and forth just like that. And that's it. It's our little thoracic mobility drill for the day. This is Dr. Chris Wilson with Think PT. See you later.